Hi folks, this is Dan with Dan's Retirement Journey, Philippines bound. While I'm here at the light rail station getting ready to catch the train to work, it's kind of dark. It's probably about 6:30 in the morning. I had a few thoughts I wanted to share. In upcoming videos, I'd like to talk a little bit about things that are important when you relocate to a foreign country. Things such as Medicare and private health insurance. So I started doing a little bit of research. I don't really understand that well how Medicare works. I know you got Part A and you got Part B. Part B comes with consequences if you don't sign up for it right away. When you're first eligible, I believe at age 65. And then you have, I think, Part D, which covers the drugs. And so this is an important issue because you're going to need to have a network of medical providers once you move abroad. And I realize that a lot of vloggers have put information online that discuss health insurance and how it works in foreign countries, particularly the Philippines. And so I think GEO, that's GIO in the Philippines, does a really good job, and a few other of the vloggers and influencers that are very popular. But so I'm taking a look at it, and uh, the two best health insurance companies for international health care are the ones who have been in the business the longest. And number one carrier is Cigna Health, which offers a program that is good for uh, both abroad in the Philippines and if you visit back to the United States. And the other one is Alliance. So I'm taking a look at those two. I'm going to have them do a formal quote for me so I can see what I'm looking at to see if it makes sense to bypass the Part B of Medicare, which costs about the average premium payments that a friend of mine forwarded some information to me last night. James, who I meet for breakfast once in a while, he was telling me the average premium payment is somewhere around $147 per month. And then you have Part D, and there's a cost associated with that. And so the whole idea here is that does it make more sense to subscribe to or to buy a private health insurance plan when you're overseas and bypass the Medicare Part B and Part D. And once I do decide to cover this subject, I want to let everybody know that I'm not trying to dissuade them from uh, buying Part B or D or paying that premium because there may come an opportunity that where they wish to use it, and the answer may be to pay the premium payments for both Part B and D and still have private health insurance. And so basically what we want to do is we want to find out, discover whether plans actually exist that will integrate that private health insurance overseas with Part B and Part D in a form of sort of like a senior advantage type of program. The only way to find that out is to contact them and start asking the questions, and that's what I plan on doing soon. I'm going to try and get to it within the next couple of days so we can go over it and see if there's a benefit towards having all the private health insurance. In the meanwhile, in the Philippines, you also have PhilHealth, but I understand that's a program that's got its problems. But from what I've understand from talking to other expats, it gets you in the door of the hospital and then gives you a somewhere between a 50 and 60% discount, sometimes more on services. So mostly in the Philippines, you either have to have cash in hand ready to go in order to be admitted, or you have to have PhilHealth, and you have to have um, or a private insurance that's recognized by the hospital group that you're going to before they'll even admit you to the hospital for any kind of medical care. So that's what we have to look forward to coming up. So I will get to work on that. like I said, the two main ones I'll be taking a look at is Cigna Health and Alliance for the purpose of the next video, to discover if they offer programs that make sense. And later on, we'll take a look at some different travel health insurance policies that are renewable, such as one that I heard about was Nomad Health Insurance and others, and we'll take a look at those to see if they make sense. All right, y'all have a nice day, and I will see you in the next video.